Hey, this is Doug Field, along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. And we're happy to have with us today Murat Philippe, Director of Workforce Consulting for Avatar Solutions. And Murat's going to talk specifically about the effect of employee engagement on patient satisfaction. Good morning to the program.
Thank you very much, and thanks for having me.
Yeah,
good morning.
It's good to have you with us. Give our audience a brief overview of Avatar Solutions and what you guys do, and then we'll talk more about employee engagement.
Definitely. That sounds good. Avatar Solutions is a measurement organization. We do surveys to measure and improve performance both on the patient end of the business, but also on the employee and the workforce side of the business. And so our work is primarily working with organizations all across the country in how they can better engage their staff, their workforces, how they can measure the effect of that engagement on their patients, and more importantly, how do you get better on both fronts?
Now, Murat, engagement, we talk about it on this program all the time, and it seems to be the big buzzword out there. If I'm an employer, what are some of the things that you can really help me with in terms of engagement and making sure my employees, are engaged in their better engaged in their healthcare?
Sure. What we can do with organizations is first off, we engage people in a dialogue, and you really have to. It's oftentimes a topic that's talked about. People define it very differently, and so I think what's really important is that you have a clear understanding of what you're measuring, and more importantly, why you're measuring it. But what you do is you involve whether it's patients, whether it's the workforce, engage them in that discussion about where you are along this journey, because everyone is trying to do right by their customers, whether their customers are the patients that are walking in the door, whether it's the workforce, the people that work at this organization. And everyone's on this journey. It's just that different organizations are at different points of the journey. Some are more mature, some have been doing this for a while, and have a pretty good grasp of the different aspects that you need to be aware of in order to really fulfill and exceed expectations for your patients and for your employees. But others need a little more help. They need to know how they compare to others, where is it that perhaps they might be falling short, and then more importantly, what are some of the things that are successful that other organizations are doing? How is it that other organizations are achieving that success? And what's nice about this is that it's not an industry where people are wishing ill on others or are not wanting to share that kind of information or to help other organizations. And so there's a great opportunity there to really identify what works, how it works, and to share that message to others that might be having a struggle in a particular area.
Murat, this is Doug.
Hi, Doug.
How does Avatar, specifically help, employers improve engagement with their employees? Because you come at it from a very unique angle in the space.
Sure. No, that's a great question. And well, the first tool we reach out with is an engagement survey. We would ask people just anywhere from maybe 15 to 30 or 40 questions. We could, customize it and make it even, more in depth. But I think that's the starting point. And so we would have a survey. We would ask employees to, whether it's physicians or clinicians, whether it's just the rest of the workforce staff, or whether it's on the patient side, we do the same thing. We just reach out to your target audience, engage them with these questions, ask them questions about career advancement, recognition, look at their supervisory relationships, take a look at their coworkers and their situation there, and also just their level of day-to-day operational, I don't know if satisfaction's the word, but where they stand and where they are in terms of their career and the work that they're doing. And then we assess, what their responses are, how they're responding, and based on those answers to these questions, then we can do some qualitative work as well and understand, the why behind the questions. Because I think there are a lot of organizations that are out there that ask the question and maybe you get a lot of data afterwards, but there isn't a real deep understanding about the causes, the root causes for these scores, and more importantly, what are some of the solutions? And so we work with the workforce also to understand the why, and more importantly, start to plot some solutions and some steps on how do you get better, how do you move forward with that.
Murat, do you work in conjunction with actual engagement solutions that are out there, whether it's some of the emerging social media solutions or other solutions? Because you're the data management and survey component, right? So can you work? So can you work with these other companies? That are maybe executing some of these engagement tactics.
Sure, we do to some extent. We have obviously some folks on our team, my team in particular, on the workforce end and the patient experience consultants, the performance improvement consultants on the patient end that actually do help in the what do you do with these results? Where do you go from here? And what are some techniques, some strategies, and some pitfalls to avoid as you move forward in the action planning phase once you have your data and once you have your results. Now, there definitely are some partners that we work with that are more on the day-to-day execution beyond that.
Okay.
So while we do get the ball rolling and we do get you started on the path, if we do have a partner that is particularly, if their specialty is a certain executable, then we'll work with them to do that. So yes, we definitely do have some partners that we work with in that regard.
Now, after you do these surveys, do you kind of see a baseline, an average of the knowledge of the actual content that you're gathering? Or can that span multiple different? Can you get different answers, different levels of knowledge around a lot of these surveys?
Yeah, it definitely, there are norms, and I think that's one of the real, value adds that organizations look for. Some places do this on their own, but what they miss out on is what's the average? What does this score mean if I don't have something externally to compare it to? And so that's, I think, one of the real value adds is the ability to say, okay, our communication score was X, but is that good? Is that an average score, or is that a below average score? Or our recognition components here, we scored Y on that. What does that score really mean? And so, yeah, it's the ability to, get a norm or get a sense of, where does this score fall in the range of the healthcare universe, if you will, that really can help an organization understand, where they're really leading the pack and perhaps where it is that they have some opportunities to grow.
Now, with that information that you gather, is that, maybe say I'm a mid-sized employer and I've got 5,000 employees, are you able to compare that to, not by name, but by company size to others? Is that how it
Exactly.
Works? Okay.
That's precisely it. So if you wanted to compare to like-size organizations, we can do that and give you a comparison. A lot of times organizations will ask for those kinds of cuts where they want to compare to other large systems or perhaps to academic teaching organizations in healthcare, or perhaps they want to take a look at magnet status organizations and compare to like peers that way. So those are the types of data comparisons that we can make.
Now, Murat, you also survey the provider-physician side, correct?
Correct.
What are some of the characteristics and some of the findings you see on the physician side when it comes to engagement?
Well, the concept is similar, but I think the drivers for physicians are a bit different. As you can imagine, I think with physicians, a lot of times what we'll find is that it's the opportunity to be a part of the strategic decision-making. It's the inability or the lack of communication between perhaps administration and the physician leadership that a lot of time fells a lot of organizations. This is where they fall down a little bit. And so that is something that I think a lot of organizations struggle with. It's a great opportunity. When you see it work successfully, that's where you really see quite the synergy, when the physician leadership and the administrative leadership are walking hand in hand and really understanding each other, involving each other, and jointly working towards solutions. That's when you see real success kind of take off, and it's where it seems the administration makes a decision and sort of imposes that decision on the physicians, where you see a lot of friction created, or a lack of harmony, or a lack of alignment in terms of trying to meet your strategic goals there at the organization. So that oftentimes tends to be when you walk into engagement, it's not unusual to run into those kinds of situations on the physician side.
Now, Murat, a lot of the physicians out there, they never had to. Their model really wasn't necessarily set up to be overly engaged. I mean, they were engaged with their patients, but it's becoming more important because as the employee consumers, and this is a question, the employee consumers coming in and being more knowledgeable almost forces the physician to become more knowledgeable about price and other options, correct?
Completely. And I think you really hit on something there with respect to the physician training and the physician leadership. A lot of times when you're going to medical school, the things that you're being taught about, it's a very competitive environment. It's the one in which, you're out for yourself. There isn't this idea of sort of team as much as there is perhaps in the business world and with administrative leadership. And so there are very different schools of training that an administrative leader would go through versus a physician leader. And those things that are taught, in the business schools as far as working together and teamwork and sort of having a consensus opinion to determine, the next course of action, it's very much in opposition to the physician training. And so a lot of times that's where that friction starts. And I think that you're spot on in terms of having to give physicians those kinds of tools and that awareness of how now to interact with the consumer, because the model, as you kind of allude to on your program, is very much changing. This isn't a situation anymore where you walk in and you just say, okay, physician, tell me what I need. I'll sign off on whatever, and you don't even ask about the price. You don't ask about other courses of action necessarily. They're the ultimate decider. And that power or that decision-making authority is having to change. So it's definitely a pretty interesting time.
And Doug had mentioned in an earlier segment, we had a conversation with a leading consultant here in Atlanta who was talking about just the doctor and the patient coming to an agreement on services. And, I would see that as something for your business that could be beneficial, but we do see the market kind of moving that way, maybe not rapidly, but could head that way over the next few years. Kind of what's your thought on that?
No, I definitely think that that's the case. I kind of make the analogy that this is similar to, in the past, walking into a high-end department store or a Nordstrom, let's say, and just saying, okay, I like, what do you recommend? And then the salesperson comes back and sort of hands you 3 or 4 things, and you give them the credit card without even asking for the price or trying things on necessarily. And so, it's definitely shifting from that to one in which you're now looking at the price tag and you're trying to see if something fits and you're trying things on, and it's much more of a collaborative effort as opposed to a very one-sided dynamic.
Well, Murat, it is a very changing world, and we've got about a minute to go on this segment, and we appreciate having you, and we'd like to give you an opportunity to kind of wrap this up and give our audience some takeaways and also how they can get in touch with you.
Sure, definitely. No, I think this idea, this concept of engagement, it's something that organizations, not just in healthcare but in all different industries, are trying to handle and understand. And I think that the reasons for it have been pretty clear for a while now as organizations link engagement on the employee and the workforce and the physician end to better results on the patient side. It's akin to an engaged employee being different from a disengaged employee in that the engaged employee maybe is going to take the time to go ahead and make make regular rounds on the patient so that there aren't perhaps an accidental fall, or so that there aren't call lights being pressed all the time, or maybe it's the nurse that's putting that information on the whiteboard and putting information about her name and how to reach her, or the patient's name, so that way when the shift change occurs, the patient feels that there's a better continuity of care, more personalized care. And you see those kinds of actions on the employee side pay off on the patient HCAP scores and on the patient results. So this is a topic it's difficult to measure. It's tough to get a handle on some of these concepts or some of these ideas, but it's an important one to measure because at the end of the day, it helps to drive your patient satisfaction and engagement. It helps to drive your growth, your financial results. We've seen it even linked to turnover and operating margins.
Well, Murat,
Sure.
I don't want to cut you off, but we're at the end of the segment, and love to have you on again. Thank you so much for participating. And to our audience, stay tuned for the next segment, Healthcare Consumerism Radio.